Have you ever had something you were truly afraid of? Maybe it's spiders, or public speaking, or even just leaving your house. And when that fear arises, what's your first instinct? For many of us, it's to avoid it. We cross the street to steer clear of the spider. We decline the invitation to speak. We stay home. And for a moment, that avoidance brings a wave of relief, doesn't it? It feels safe. But here's the thing about avoidance. While it offers immediate comfort, it's actually a trick our brain plays on us. It teaches our brain that the very thing we're avoiding is indeed dangerous, strengthening the fear over time, not weakening it. It's like a tiny leak in a pipe that you just keep putting a bucket under, instead of fixing the pipe itself. Eventually, the whole room floods. Today, we're going to talk about a powerful, evidence-based psychological treatment that helps us fix that leaky pipe: exposure therapy. It's a core component of cognitive behavioral therapy, or CBT, and it's designed to help you confront and ultimately overcome those fears and anxieties, not by ignoring them, but by facing them in a safe, structured way. Now, you might be wondering what this looks like in practice. It's not about being thrown into the deep end. The therapeutic process always begins collaboratively. You and your therapist will work together to create what's called a fear hierarchy. Think of it as a ladder, where each rung is an anxiety-provoking situation, ranked from mildly uncomfortable to your biggest fear. Imagine someone with a fear of heights. The bottom rung might be looking at a photo of a tall building. The next might be standing on a chair. Further up, it could be going to the second floor of a shopping mall, and the very top might be looking down from a skyscraper observation deck. Exposure always begins with those milder items and progresses gradually, at your pace. Your therapist is there every step of the way, guiding you and providing coping tools. There are different ways to do exposure, depending on your fear. In vivo exposure means directly confronting the real-life feared object or situation, like actually going to that public park if you have agoraphobia. Imaginal exposure is vividly imagining a feared stimulus, which is often used for traumatic memories where direct confrontation isn't possible or safe. Interoceptive exposure deliberately triggers physical sensations associated with panic, like rapid breathing or dizziness, so you can learn they aren't dangerous. And with new technology, we even have virtual reality exposure, using VR to simulate feared situations, like flying or crowded spaces. While graded exposure is the most common, steadily climbing that fear ladder, some specialized approaches include prolonged exposure, PE, specifically for PTSD, combines imagining the traumatic memory with real-life exposure to trauma-related situations. And for OCD, there's exposure and response prevention, ERP, where you're exposed to an OCD trigger, but then guided to prevent your usual compulsive response. This helps break that obsessive-compulsive cycle. The beauty of exposure therapy is its wide applicability. It's highly effective for specific phobias, social anxiety, panic disorder, agoraphobia, generalized anxiety, OCD, PTSD, and even acute stress disorder. Leading organizations like the American Psychological Association and the Exposure Therapy Consortium endorse and promote its use because the evidence is so strong. Now, despite all this powerful evidence, exposure therapy faces some common misconceptions. You might hear people say it sounds too scary or even unethical. This myth suggests the treatment is cruel because it intentionally evokes distress. But let's be clear, it is always conducted in a safe, controlled, and completely voluntary environment. Informed consent is paramount, and your welfare and individual pacing are the top priorities. The discomfort is temporary and purposeful, leading to lasting relief. Another common misconception is that it makes anxiety worse and doesn't work. It's true that anxiety will temporarily increase during exposure. This short-term distress isn't a sign it's failing. It's a crucial part of the learning process. It's how your brain learns that the feared situation isn't actually dangerous. Without that temporary activation, the learning wouldn't stick. Some also mistakenly think it's just facing fears head-on without support. This ignores the fact that exposure therapy is a structured, gradual, and guided process. Therapists provide essential coping tools, support, and debriefing. You are never alone in this process. And what about complex patients? There's a myth that individuals with severe or complex symptoms, or even co-occurring conditions, can't handle it. While careful assessment is vital, and it may not be suitable for those with active substance use disorders or unstable mental health without prior skill building, research shows many individuals with complex needs can benefit. For complex trauma, a highly skilled and compassionate therapist is absolutely essential.
A significant challenge, despite its proven efficacy, is the underutilization of exposure therapy by mental health professionals. Many therapists, unfortunately, don't widely employ it. This can be due to negative beliefs, lack of confidence in delivering it effectively, concerns about client distress, or simply insufficient specialized training. Addressing this gap in training and knowledge is crucial for the future. Exposure therapy remains a gold standard treatment due to its consistent, evidence-based efficacy. It's not static. Researchers continue to refine techniques, and organizations are dedicated to improving outcomes. The future of exposure therapy is truly exciting. It centers on addressing its current underutilization, increasing specialized training for mental health professionals, and disseminating accurate, clear information to both therapists and the public. This push for broader adoption, improved accessibility, and enhanced understanding aims to ensure that more individuals struggling with anxiety-related disorders can benefit from this powerful and proven path to reclaiming their lives from fear. If you or someone you know is struggling with anxiety, understanding exposure therapy might just be the first step towards a different, freer future. It's a journey of courage, learning, and ultimately profound relief.